Good afternoon to everyone. Eddie, good afternoon to you. Welcome to today's weekly update. I have a number of items to discuss today. I'm pleased to be joined today by Dr. Jose Romero of the Department of Health, Secretary Larry Walther, Department of Finance. We have Secretary Johnny Key of the Department of Education, and we also have Dr. Tony Thurman, who is the Superintendent of the Cabot Public Schools, joining us today and either answering questions or making a comment. First, I want to address what has been discussed as the upcoming special session of the General Assembly. And I wanted to outline today, first of all, what is designed to be considered in a special session in terms of a tax reduction plan, and then talk about the session itself. And first, everyone knows that I have been fully supportive of lowering the individual income tax rate in Arkansas. I've worked very closely with the Tax Writing Committee chairman as well as the leadership of the House and Senate, trying to reach a consensus on what should be in a tax reduction plan. And there are three principal parts that are being considered and are part of this plan. First of all would be a low income tax break, which would increase the individual tax credit from $29 to $60 for those making less than $22,900. This would cost general revenues $19.6 million when fully implemented. That is one of the elements of the outline that's being considered. Secondly, we would combine the low and middle income tax tables, which focuses on a tax break for middle income individuals. And that would be $132.7 million when fully implemented. And the third part of it would be a critical element, lowering the top rate from 5.9%, which it currently is, to 5.5% next year, and then to 5.3% on January 1 of 2024. That would cost $54.8 million when fully implemented. There's also discussion about reduction of the corporate tax rate, and some of that would have to be triggered based upon meeting certain financial revenue responsibilities of the state to make sure the RSA is properly funded. And so I wanted to outline this. Whoa, that is too small. But that will be available to you, which is a breakdown of it. I did want to emphasize a couple of points. If this outline that I have presented today would be adopted, you would see in FY 2024 a total reduction in general revenues of $321 million. That is a very large tax reduction package. And then it breaks down in the second bracket the savings by income range. And you can see every income bracket as to how much that would result in savings for the average taxpayer. And then very significantly in the third bracket, if you'll see the next one, then you see on the right column, the left column is the income range, and then on the right column is the percent of the tax cut that would be in that income range. And so, and you can see that that adds up to 100%. But if you look at that, you'll see the 7.1%, which is that column right there, the 7.1% of the tax cut goes to that income category, and then the next one would be 16.6%, and the next one goes up to $82,000. And so if you look at Arkansas taxpayers that make less than $82,000 will get the benefit of 56.6% of the tax cut. And so that is really a large part of the focus of middle income as well as low income even though we are also reducing the rate that would benefit all taxpayers in a higher income level as well. And again, let me emphasize that we've worked hard with our legislative leadership. There's not been there's a broad agreement that these ought to be elements of the plan. We're trying to look at how the legislation can be drafted, and of course I rely upon the legislative leadership to do this. So certain elements of this are still in discussion, and we want to be able to get the facts out so that the public can participate in this conversation, and that's a part of it. We want to be transparent what the different elements are. I think this is a good tax reduction plan, and most importantly, it can be paid for out of recurring revenue and not one-time money. And that leads to two other announcements on this particular point, and that is that there's not going to be a special session next week. For a number of reasons, we need more time, and so that session that I said was tentatively scheduled for next Monday, October 25th, will have to be delayed. I'll work with the legislative leadership in finalizing this outline into hopefully a bill form, and that we can generate the support that is needed to pass in the session. It also, as you know, there's other issues that have been brought up, and it gives more time to analyze that, and hopefully we'll have some Supreme Court guidance in the coming weeks that might shed some light on other items that members have mentioned might need to be want to be discussed during that special session. And then finally, we have Secretary Larry Walther here, who has a responsibility for looking at the forecast, making the forecast, and revising it as needed. I've had discussions with Secretary Walther, and he's advised me that the forecast will be revised this afternoon, and that will be revised upward in terms of revenue, and that will be revised for the current fiscal year as well as the next fiscal year. What that means is that with the growing economy that we have, with the revenue picture that we have, with a surplus that's being built up, the revenues picture will be revised upward, which will allow recurring revenue for the tax cuts that have been outlined. And I think that's important information also for the members of the General Assembly to have as they consider this, as well as the public and others that are dependent upon general revenues for the delivery of education services as well as public safety. And now let me shift to the pandemic and the latest case report. And let's go through the case report first, and then I'll come back and have some announcements to make. First of all, I think this is broken down by category, is it not, on the next one? But we'll look at this. There you go. That's what I wanted to see. So here you can see the 661 new cases from yesterday, which is down from the previous week. We're always looking at the previous week. This is down again, which continues the good trend. Active cases down, deaths regrettably 19, and we still lose our Kansans to a disease that kills. Next, you'll see the vaccinations. We've given out 7,255 doses over the last 24 hours. And of this, you see on the bottom line that we have 3,000 additional Arkansans that have been fully immunized. Those are the numbers we'd like to see go up, so it's gone up 3,000 over the last 24 hours. Hospitalizations, fairly steady, up 1, down on ventilators. Next, you'll see, and this leads to a discussion on the quarantine requirements in the public schools. And this is an important conversation. I see Representative Brian Evans here, and I want to thank you. He brought a number of school superintendents in that made a case that the quarantines are really causing a great deal of loss in education. and they questioned some of the balance that we have. And Dr. Romero was there on that meeting. I applaud him and his team for taking a look at this and having some creative alternatives to strengthen education, but also make sure we continue to focus on the public health as well. And so based upon those conversations, we have an announcement that the definition of a close contact in a school setting will be changed from within 6 feet for 15 minutes to within 3 feet for 15 minutes. And that's a significant change that will help our schools minimize the quarantining and balance that with the needs of the public health with the students. And then secondly, we have our pilot program on our test to stay protocols that said that if you can avoid quarantine if you're vaccinated. You can avoid quarantine if both you wear a mask and the person that exposes you have a mask on. And then you can also avoid quarantine if you go through testing. That previously applied to everything in the school except for extracurricular activities. That now, the test to stay protocols will now apply to extracurricular activities instead of only applying during the school day. The reason for all of this is that if you're in band, if you are have extracurricular activities in music or others, this is a critical part of the young person's development, and it is something that's important in the education atmosphere. So we're making that adjustments. And again, remember, vaccination is the most important tool to eliminate quarantines or to eliminate risk, and the other one would be being masked. And so with that, that covers the issues that I wanted to cover today. I'll ask Secretary Romero to come for his comments, and then I'll ask Dr. Thurman to come as well.
Thank you, Governor. Just to reinforce what the Governor said, the Arkansas Department of Health has looked at the CDC guidelines and has modified them to meet certain demands on children being able to stay in school and allow them the opportunity to have education in place and participate in sports. I want to reassure the public that we will not be neglecting to follow the cases that occur after this modification. If the Arkansas Department of Health sees an increase in the number of school cases, we will make a recommendation to the governor that we should go back to the 6-foot distance for quarantining. Again, this is important also to know that this does not affect daycare centers, child care centers, or higher education. This is only K through 12. The governor pointed out that we can eliminate quarantine if you vaccinate. So vaccination is the best way to avoid going into quarantine. If both individuals, the index case, that is the individual who's sick and the person who's exposed, are wearing masks, and if the individual has a recently physician-diagnosed case of COVID in the last 19 days, they're considered to have immunity at that point. It is not a test done at home or a test specifically. It has to be a diagnosed case of COVID. My last comments deal with vaccination in general. So our rate of vaccination in children or adolescents 12 to 18 has stalled. We are at 49.9% for one dose and 39.8% fully immunized. We need to get them vaccinated. And lastly, I expect to see vaccines for children 5 to 11 available beginning of next month. Thank you very much.
Thank you, Governor. Tony Thurman, Cabot School Superintendent. And on behalf of all administrators in the state of Arkansas, I want to say thank you, Governor. And Dr. Romero, thank you for your consideration. As the Governor explained, we did have a meeting. Representative Brian Evans did set that up, and we shared some concerns that we're seeing in our schools with a number of students that are being quarantined as probable close contacts. And of course, the distancing issue is what's been addressed today by the Department of Health, and that is much appreciated on behalf of all school personnel. This is going to be a huge game changer in our business for several reasons. First and foremost, for students. The best way to battle learning loss is to have kids at school. And we're seeing a large number of kids that are at school as probable close contacts that are not testing positive. And of course, those healthy kids need to be at school. If they're symptomatic, they need to be home. If they're sick with COVID, of course, they need to be home. But those other students, if there's any way possible, they need to be at school and learning in our classrooms. This is also a great advantage for our teachers. Our teachers are stressed to the max right now. And anything that we can do to decrease the number of students quarantined, that's actually going to be better, because that means those students are in class, and that's the best way to provide the most efficient mode of instruction. Our teachers want to do a good job. Our administrators want that to happen. But it's extremely difficult when you have students that are home as probable close contacts for an extended period of time to actually provide the quality instruction that those students really do need at this time. And finally, for our parents, when your student is quarantined for an extended period of time, that has an impact on jobs and work. There's just so many effects there. So we are so appreciative of this flexibility. And one thing that I do assure Dr. Romero, and I'm speaking to all of my school friends out there, the one thing we've got to be careful about is, it's been giveth and it can be taketh away. So while we're extremely proud of this flexibility, moving to 3 feet on the PCC criteria, we do understand that there is an increase in cases. We will go back to the 6 feet. So we must remain vigilant. We've got to keep all those protocols in place that we've had, the focus on sanitation, disinfecting, hand washing, social distancing, and really make sure that those students, if you're sick, you do not need to come to school. I know it's allergy season, it's flu season, but if you have any symptoms, do not come to school until we're absolutely sure that you're ready to return safely. So with that said, again, Governor, we will do our best. Dr. Romero, we will continue to be vigilant, and we do understand on behalf of all administrators in our state that if there is an increase, we will go back to the 6 feet, but do appreciate this consideration.
Thank you, Tony. And Secretary Key.
Thank you, Governor. The report for this week for our K-12 cases, we're down to 1,080, as was reported yesterday. Represents another week-over-week decline in the number of active cases in our K-12 schools. We have had one district this week that has reported a shift in instruction, and that was a kindergarten, one kindergarten class in Rogers. Otherwise, we continue to have very smooth operations in our school districts, and the announcement today of the 3 feet versus 6 feet change will help make that even smoother. Dr. Thurman, you stressed exactly what I was going to stress, and I'll stress it again. Parents, caregivers, if your students are sick, if they are showing symptoms, please keep them at home. As we shift this guidance, it is more important than ever that we pay closer attention to the other mitigating effects, the other mitigating steps that can be taken with respect to the spread of COVID. But I also, because we have heard from many school districts, large and small, all over the state, I want to give thanks to Dr. Romero and the health department team for their constant vigilance in helping us solve the problems that are being brought to us by our school districts, by our superintendents, and by others in our communities.
Thank you, Johnny. And with that, we'll take any questions.
Governor, if I heard you right, you referred to phasing in some corporate income tax reductions, but you didn't say anything about phasing in a reduction to 4.9 on an individual basis. Is that no longer on the table?
No, it is. That's under discussion as well. You have to get the right trigger, but that is something that's important to many members, and I have no objection to it as long as the services of the state are protected and there's the right trigger, but that remains to be seen as to whether that will be part of it or not.
Issue on the trigger.
I think getting it right, and I'm not involved in the drafting of that bill. I know that Bureau of Legislative Affairs is looking at that, so you'll have to get more background on any issue with that from other members.
So you're expecting a special session to be called before Thanksgiving?
I'm not going to put a time frame on it, I certainly would hope that. We'd like to give as much time as possible for employers, but also taxpayers and tax preparers as they look at next year. But there's not a specific time frame on that. It all depends upon getting it drafted right and getting everybody, the majority, to agree to it. And it has to be acceptable to me. I'm the one that makes the call, and so we've got some more work to do on it first. But we certainly hope that it will be before then, but that remains to be seen.
Neither the speaker nor the pro tem came to you and said, hey, can we hold off a couple weeks? Because we went through a rough end of the regular session. We need to let people cool down. That's not what's really going on?
No, I mean, there's some members, but I wouldn't certainly attribute it to the speaker or the pro tem. But everybody has a different sense of coming out of the extended regular session. There were some challenges there, some weariness, but we're going to have to face those issues, whether it is next week or 3 weeks or 4 weeks. You're still going to have the same debate. But obviously it did wear some people out. But I think the bigger factor is, one, agreement on the tax cut plan, and then secondly, I would like to see a consensus as to how we're going to handle other issues that members want to bring up, whether we can say, no, we're going to stick to everything just on the call and not bring in other matters, or whether there's some other matters of urgency that needs to be added to the call. And so there's just more work to do on both those categories, but time will help us.
I know you said that one of those issues that you're waiting on is guidance from the Supreme Court. Would that be on abortion issues that you expect to discuss in that special session?
Yes, and we may or may not get it, but of course the Texas case is in front of the United States Supreme Court. We may get some guidance from that, but I know how the Supreme Court works, and they may issue a per curiam order that doesn't give guidance. It just gives a summary opinion or temporary guidance on it. So that's not a guarantee, but we might have guidance in the next couple of weeks that would be instructive to us from the Supreme Court.
And I know you said for the redistricting special session that you wanted, to stay mostly on task and on redistricting without too many other off-topic bills. Is this something then you expect to talk about abortion and other off-topic bills for this next session?
No, I believe that if we're going to have a special session, we should stick to the call that I issue. That's a responsibility of the governor. And, members have brought other items to me. Some of them have consensus, some are technical corrections, and you'll see that when we do a call, there'll be other items that will be a part of it. But no, I think we need to stick to the call. I don't believe that we need to get beyond that, but there has been some discussion by members that they want to raise these issues. And so I want to have as much information as possible as to, one, whether anything should be added to the call, and then secondly, if the members will agree to limit the special session to the call and the items on it as what I believe is designed by the protocols set forth in the Constitution.
My understanding was that you had originally indicated that you weren't going to hold any Board of Apportionment meetings until after the special session. Is that still the case, or is that changed given that we're not going to have a special session next week?
The Board of Apportionment very well will meet now before the special session. That still remains to be determined, but clearly I'm going to delay the special session. And the Board of Apportionment has its own timelines, and the intent right now is to stick with the timelines that we would have the next meeting of the Board of Apportionment before the end of this month.
School protocols for quarantines, is there, scientifically, any reason to think that there's a different risk level for transmission and among children in K through 12 schools than other environments? And also, some of these school districts, like in Cabot, don't have mask mandates, which conceivably would also reduce quarantines. So what's the reason for giving them this other option rather than the mask option?
It's a very good question. I'm going to answer it, but I'll ask Dr. Romero to come and talk about it from a medical standpoint. And clearly, if you were at the height of the pandemic, I don't think this is something you would do. But as a leader, you have to balance the risk and the losses. Right now, we're having severe hardships in our schools to the students, and learning loss and a lack of participation and dropping out. And that is a huge human loss as well, and a risk. And so where we are in the pandemic with low cases, with good numbers in our schools, we got here through hard work. But at this point, you balance those equities, and we're given a little bit on the perfect science in order to increase the opportunity for students to participate and not have to undergo quarantine with the minimal risk at this point. Dr. Romero?
So you are correct that the safest thing to do is to keep the 6 feet. As the governor has pointed out, we are balancing the needs of the student with the needs of public health. Children are suffering from not being in class. They have the psychological issues, they have the learning issues, and so we think this is a safe alternative at this time. But as stated before, we're not just turning it loose. We're going to follow it very closely. With regard to extracurricular activities, so we believe that daily testing with PCRs for those individuals that want to participate in school, if you will, test to play, will offer that degree of safety in those settings. So we're not the only state that has modified their quarantine measures for kids. We've looked at that, and we will continue to follow this forward. So it's not a static change. It's dynamic, and it will modify if cases go forward and increase. Thank you.
Just the question is, like, there's one option that a lot of the school districts are not taking advantage of, and now they're being given another option. So what's the law?
Well, the mask option is law, right? I mean, we can't go against what is state law, and that state law was enjoined but now has been reversed. So again, we're working with what we have, and we know that school districts, some will adopt the safer measure, which is to keep the mask in place, but we cannot force that.
Make it clear that the school districts remain and have the option of mask or not mask. The school districts have that option. But regardless of that option of mask, we believe that this is important. They have the option of vaccination, the students do, but this gives the maximum flexibility in the schools to increase learning. Is there any questions remotely?
Governor, this is Andrew with AP. Going back to the abortion issue, just to make sure I understand, are you leaving open the possibility of putting that on the call if there is guidance from U.S. Supreme Court on the Texas law? And the flip side of that is, if there isn't that guidance, would you still consider putting that on the call, or is that the only condition that you would even look at that issue?
First of all, what I've said and what my position is now is that we have a very restrictive anti-abortion law that's been passed in Arkansas that prohibits all abortion except to save the life of the mother. And that has been enjoined by the courts, and so that's working its way through the courts. You have the Mississippi case that's working its way, that I believe is a 6-week ban. You've got the Texas case that's working its through. And so what we need right now, we have restrictive abortion laws. We need resolution by the courts, and it would be wiser to wait until we get that guidance before we start passing laws again. And so if we get guidance, then I'm open to looking at that guidance and seeing what step Arkansas should take, if any. But at this time, I have stated that that is not something that we should do now because it's in the Supreme Court. Let's wait and see what kind of guidance we get from them. And we also have a very, very restrictive abortion law that's already been passed in Arkansas. All right, with that, I don't believe I cut anybody off, so thank you all very much. Have a great afternoon.